Hi, my name is Brianna Falmy, and this is my assessment video for my assessment class. It's a head-to-toe video. So the first thing I'm going to do is approach my patient and introduce myself and explain why I'm here. Hi, my name is Brianna Falmy, and I'm going to be your nurse today. Will you please state your name and date of birth?
John Luca, 06/04/1991.
Okay, great. Thank you so much. And I'm here to do a head-to-toe assessment on you today. Do you have any questions?
No.
Okay, great. Thank you. So while I talk to him, I'm going to just take a general survey of his appearance, his hygiene, any abnormal odors, his facial expression, his skin color and demeanor, and I will assess his level of consciousness and response to instructions as part of my mini mental states exam. Okay, so the first thing I'm going to do is take his vital signs. Which would be his height and weight, which I've already taken outside of the room, and that would be 5'10" and 140 pounds. And now I'm going to take his temperature, blood pressure, pulse, and respiratory rate.
Rachel, text me if you have questions or so.
Here's his temperature.
Tonight, okay? Yeah, I will. So, should I do like these and then try working around your hands?
Perfect. 98.6. And now I'm going to take his blood pressure.
And then sorry. Good thing I'm not okay, so shimmy first, then and if you kind of work your next, you'll have to step over a lot more. Well, that depends on how bad you're in that area.
Great, thank you. For that, I got 120/60. And now I'm going to take his heart rate and his respiratory rate. Great, thank you. So now his pulse was 68 and his respiratory rate was 16. So now I'm going to do my mental status exam. So while I'm talking to the patient, I'm going to assess his speech pattern and ability to follow directions. So the first part, I'm going to ask you to remember these 3 words, and I'm going to ask you again for the words in a few minutes. So the words are house, lake, and car. So remember those. All right, now I'm going to go on to assess his orientation. So these questions might sound odd, but they're part of the assessment. I was wondering if you could tell me where we are right now.
USF.
And what's today's date?
May 6th.
Yeah, and then also, and what is your name?
John Luca.
Perfect. All right, so he's oriented to person, place, and time. And so now, do you remember those 3 words?
House, lake, car.
Perfect. Great. Thank you so much. All right, so that concludes my mental status exam. I'm going to move on to assessing the skin, hair, and nails. So the first thing I'm going to do is assess the color of his skin. It's not pink or flushed. And then I'm going to assess his mucous membrane color. Perfect. Great. So everything looks pink, moist, and intact. So the patient's age does appear close to his age stated on his record, which is 23. And so now I'm going to assess hair texture, quantity, and distribution. And I'm going to assess the nails for color, shape, and hygiene, and look for any visible rashes, scars, or discolorations. your hands. Some nails. Good. And then hair. Looks good. Alright, now I'm going to move on to the head and face, eyes, ears, and mouth. So the first thing I'm going to do is observe for facial symmetry, which is checking cranial nerve 7. And then I'm going to move on to the sharp and dull sensations on the forehead, cheek, and jaw using a pencil tip and a pencil eraser. Alright, so first I'm going to assess for symmetry. Everything looks symmetrical. And now I'm going to assess for sharp and dull sensations, the discrimination here. So tell me if you feel sharp or dull.
Sharp. Dull. Dull. Sharp. Dull.
Dull. Okay. And then slide.
Sharp. Dull.
Okay, great. So he was able to discriminate between the sharp and the dull. Will you puff out your cheeks for me? Okay, and then frown. Great, and then raise your eyebrows. Alright, everything is symmetrical and looks intact. So now I'm going to palpate the strength of the sternocleidomastoid muscle as patient turns head against my hand, which is checking cranial nerve 11. Thank you. So just turn your head against my hand. And then on the other side. Right. So first I'm going to do the preauricular, and then the parotid, and then the tonsillar, and then the submandibular, and the submental, and then the posterior cervical, and the anterior cervical, and then occipital, and supraclavicular. It's great. So did you feel any tenderness? I didn't feel any swelling, so that's good. I think you can, now if you want to sit on the edge of the bed. Great. Thank you. Alright, so now I am going to move on to the eyes. I'm going to assess to make sure that the lids are symmetrical and make sure that neither are drooping. I'm looking for any discharge present, which I don't see any crest on the eyes. And I'm going to check the color of the sclera, which is white, and the conjunctiva, which is pink. And I'm also checking for any periorbital edema, which I don't see any. So now I'm going to check cranial nerves 2 and 3 with my pen light and pupil meter. So just look ahead of me. So the pupils are equal and round, and they react to light. I'm going to make sure that they accommodate. Let me just look at my pen, please. Yes. And they accommodate as well. Also, the corneal light reflexes are equal bilaterally. So now I'm going to just check his cardinal gazes and convergence for cranial nerves 3, 4, and 6. And while I'm doing this, I'm going to look for nystagmus or twitching of the eyes. So just follow my pen if you can. Alright, great, and he was able to do all 6 gazes. So now I'm going to move on to the ears. I'm going to look for any abnormalities of the outer external ear, or any discharge present, which I don't see any. The other ear. So there's no discharge present, and everything looks great. So now I'm going to use a tuning fork for the Weber test. Tuning fork. So I'm going to strike the fork and put it up on your forehead, and you just tell me. I'm checking to see that you can hear it in both ears, or tell me if you can hear it in one ear or the other, if one is stronger. Did you? How did you hear that?
This year's stronger.
One ear stronger than the other? Okay, great. Okay, so now I'm going to move on to the mouth. Will you please open your mouth? I'm just going to look to see for any redness. Everything looks good. Everything is moist and intact in there. There's no foul old odors or inflammation noted on the tongue or the palate. Let me open again. Say
Ah.
wider. Okay, so the tonsils don't look inflamed or red. I'm going to palpate the temporal and masseter muscles while the patient clenches his teeth to check cranial nerve 10. Just clench. Okay, and then let go. Relax. Okay, clench. Oh, yep. Both are equal and strong. So now I'm going to, while I've been talking to him, I was assessing his voice. I'm going to assess swallowing. And so I'm just going to make sure that his thyroid is midline and that it moves and it swallows easily, which it does. And then also just say ah for me. Great, thank you. So will you move your tongue out side to side? Great, perfect. So that was to check cranial nerves 9, 10, and 12. So I already checked that the trachea is midline. I palpated the lymph nodes and the thyroid gland. It is both midline, smooth, and symmetrical. And I observed his ability to swallow, which he was able to. And now I'm going to move on to palpate the carotid artery. Just put your head straight. Great, and now I'm going to check cranial nerve 11 by having him shrug shoulders. Shrug your shoulders against. I'm going to push down, you shrug. Okay, great. Alright, and now I'm going to assess the chest, and while I do this, I'm going to assess the chest, the lungs, and the heart, and while I do this, I want to be careful to maintain patient privacy as best as I can. Okay, so the first thing I'm going to do is check the contour and symmetry of the chest, which looks normal, and I'm going to move on to the lungs, and the first part of that would be observing his desired posture to see if he was leaning forward or using any accessory muscles for breathing, such as intercostal muscles or accessory muscles of the neck. And then I'm also going to listen for respiratory stridor or any audible breath sounds before using my stethoscope. So now the first thing I'm going to do is check the anterior part of the lungs. So I'm just going to check from side to side. So every time I move my stethoscope, just take a normal breath in. Okay, great. So everything sounded normal. So I'm just going to let him catch his breath before I move on to the posterior portion. Just every time I move my stethoscope, just take a regular breath in. Alright, everything sounds clear bilaterally. So now I'm going to move on to, also the length of his inspiration and expiration were normal, and I didn't hear any adventitious sounds. So now I'm going to move on to the heart. I've already inspected the chest wall shape. The first thing I'm going to do is palpate the point of maximum impulse, which is at the 5th intercostal space, at the mid-clavicular line. So please pull it up. Thank you. Alright, so I can't feel any vibrations, which is good. Now, and I palpated it for thrills, which were not present. And now I'm going to palpate his carotid pulse as I listen to his heart sounds to help identify S1. Alright, great. Everything seems normal. And so now I'm going to just auscultate each valve, starting with the aortic. So that's the second intercostal space and the sternal border. And then I'm going to go to the pulmonic. Tricuspid. And then to the mitral. Alright, great. And there were no abnormal sounds. Alright, now I'm going to move on to the abdominal assessment and the peripheral vascular system assessment. So the first thing I'm going to do is assess the abdomen for contour and symmetry, and also I'm going to look at his skin for any presence of distension or scars. And so contour and symmetry looks good. I don't see any scars or distension, and so now I'm going to move on to auscultating all 4 quadrants for the presence of vowel sounds. Alright, and there were vowel sounds in all 4 quadrants. So now I'm going to percuss all 4 quadrants for tympani and dolmus. And so if I reach any tympani, that could indicate that I'm over an organ such as the liver. Alright, everything sounds normal. And now I'm going to move on to palpating all 4 quadrants. So I'm going to start with light palpation first, and then I'm going to move on to deep palpation. Alright, so just tell me if you feel any tenderness. Looking for any masses. I did not see any masses, or there were no signs of distension, so I'm going to move on to deep palpation. Great, and then now I'm going to move on to palpating the liver edge. So if you can just leave it in here for me. Thank you. So I wasn't able to palpate the liver edge, but this could be a normal finding if it is not enlarged. And now I'm going to just palpate for rebound tenderness. Just let me know if you feel any tenderness when I release my hand. No? Okay, great. So there was no rebound tenderness. And I'm going to move on to assess the peripheral vascular system. So the first thing I'm going to do is inspect for skin discoloration around his ankles and feet over here, which none are present. And now I'm going to inspect for edema in the ankles by just depressing my fingers on there, on his skin, which there is no edema. I'm going to move. and cross your legs for me? Thank you. So as you can see, there's no discoloration in his feet, which could indicate peripheral vascular issues. There's no varicose veins, and there's no edema in his ankles, as you can see. So now I'm going to palpate his dorsalis pedis pulse. Alright, and it is present in both feet, and 2+ grade, which is brisk. And now I am going to I'm going to compare his apical pulse with his dorsalis pedis pulse. Alright, great. And those are pretty equal in both rate and rhythm. So now I'm going to move on to the musculoskeletal and neurological portion of the exam. So the first thing I'm going to do is observe his walking and his gait. So just walk to the end of the room and back for me, please. Perfect. Alright, so everything looks good. So now I'm going to, if you want to sit down, or actually let me assess for scoliosis first. Will you turn around? Great. And then so I don't see any S-shape or curvature of the spine, so just bend forward a little bit. Back. Great, yeah, so it's straight here. Great, thank you. And then you can just sit down for me, please. Alright, so now I'm going to assess his hand grip, so if you just grip my hands. Great, so those are strong and equal bilaterally. So now I'm just going to observe the joints of his hands and knees for edema. Great, and there's no edema on either. And so now I'm going to, while he was walking, I was observing for decreases in mobility, but I can also do some range of motion tests now. So you just your arm for me, okay, and then up, and then down, another arm, down, and then cross your arms. Great, so the range of motion in his arms looks good. So now with your knees, both flex and extend both knees. So now I'm going to move on to the neurological exam. So the first part of it was assessing his gross motor walking, which I've done. So now I'm going to assess for pronator drift. Will you please stand up for me? And then just hold your arms out in front of you like this with your palms up. Great, and then just shut your eyes. Alright. Alright, so that looks good. Neither arm drifted to a side, which would be an abnormal finding. So now I'm going to move on to the last portion of the assessment, which is to assess his deep tender reflexes. So the first thing I'm going to do is assess his brachioradialis. So I'm going to look for extension of the thumb when I strike his radial bone adjacent to his styloid process. So if you can just relax your arm and just lean on my hand. Just make it fully relaxed. Great, and then now the other one. Relax your arm. Great. So now I'm going to move on to the patellar, to the knees. So just sit back on the bed so your legs dangle. Alright, so I'm just going to strike this part of the knee and look for a reflex. Good. Alright, great. So now I'm going to move on to the ankle. So relax your feet. So dorsiflex the foot and strike the Achilles tendon. And you can use it with the foot. Great. So now I'm just going to do the Babinski, which is the bottom of the foot. I'm just going to use the back of the reflex hammer and stroke from the heel along the lateral side and across the toes. And an abnormal response would be to fan out the toes, and there was no response like that, which could indicate neurological damage. Alright, great. So that concludes my assessment video. I hope you enjoyed it. Thank you so much.